Hi, my name is Felicity. I'm a therapeutic radiographer at University Hospitals Dorset, and I work at the radiotherapy department at the Poole Hospital site. Therapeutic radiographers form part of a group known as Allied Health Professionals, and we are the third largest workforce in the NHS. As a therapeutic radiographer, my job is to plan and deliver accurate, targeted radiotherapy treatment. This usually involves high-powered X-rays to plan and treat cancer, as well as some other conditions. It is different from diagnostic radiography, which involves using X-rays to diagnose conditions. We play a vital role in the treatment of cancer. Radiotherapy is used either on its own or in combination with other treatment methods, such as surgery and/or chemotherapy. Patient care is at the heart of our profession, as we support our patients at a critical time in their lives. As a therapeutic radiographer, we never work on our own. We are part of a wider team to care for patients. We tend to work a 9-to-5 type of day, although we need to be flexible to ensure that our patients are well looked after, and so we sometimes work the odd weekend or an evening. Radiotherapy is a profession which is always changing and progressing, but the care of the patient is always at the centre of what we do. Radiotherapy is a degree course available at select universities across the UK, and there are lots of exciting career opportunities once you qualify. Being a student therapeutic radiographer involves a mixture of academic learning at university and also clinical placements in a radiotherapy department. Being a therapeutic radiographer involves working with the patient at every stage of the radiotherapy pathway. It starts at the point where the consultant thinks that radiotherapy would help to cure or to control cancer or other conditions. Radiation treatment is often delivered as a course and can involve multiple sessions. Most patients will come to us as outpatients, but we do sometimes see inpatients. We work in a dynamic, fast-paced environment and treat 30 to 40 patients per day on each of our 4 treatment machines. But patient care and safety is at the heart of what we do, and no one day is ever the same. Therapeutic radiographers need to be able to use a range of expensive and highly technical machines, such as linear accelerators, planning CT scanners, ultrasound machines, and specialist planning computers, whilst also providing exceptional care to our patient. The first stage of the pathway is the planning of the treatment. This usually involves the patient visiting for a planning CT scan, where we map and measure the patient to provide the consultant with enough information to accurately plan the treatment. When the patient arrives for planning, it is often their very first time in a radiotherapy department. It can be a very worrying and scary time. Most people will not know what to expect, and so it is very important that we explain the procedure, reassure, and answer any questions before we go ahead. Radiotherapy is not painful, but we often ask our patients to stay still for up to 30 minutes at a time. For the planning scan, we need to be able to reproduce the exact setup when the patient is being treated to ensure accurate treatment delivery. We take detailed records of what we do at planning, so attention to detail is extremely important. Therapeutic radiographers are responsible for making any customised devices that help to keep a patient still, depending on the area of the body that we will be treating. If we are treating the head or neck area, then often we will make a head mask of that patient at the planning CT scan. This is a simple procedure for us, but for the patient it could feel a little bit claustrophobic and potentially overwhelming. It is our job to reassure them and to make them feel comfortable so that they can tolerate the procedure. When we are treating other areas of the body, we will often need to apply permanent marks to the patient's skin at their CT planning scan near towards the area we are treating. This is so that we can accurately reproduce the exact same position every day for treatment. Once we have all the information from the planning scan, then we will send the patient home with information about what to expect regarding their radiotherapy treatment. The information we collect at the planning appointment is then sent to a planning computer and is used to simulate the treatment. At this point, we can also understand the potential effects of the radiotherapy on that part of the body, And so we work closely with physicists and consultants to ensure that we treat the cancer while sparing normal tissue which might cause unwanted side effects. When the patient attends for their first radiotherapy treatment, we will again take time to talk to them before they go into the treatment room and reassure them about what to expect. We will answer any questions and confirm that they are happy to go ahead. Radiotherapy is painless and relatively quick. Each session will typically last only a few minutes. Before we can treat the patient, 2 radiographers will need to manually move the patient into the correct position, just as they were in the CT scanner, by using the tattoos and lasers from the walls. We are now using surface-guided radiotherapy. This is state-of-the-art equipment which uses optical body mapping to make sure the patient is in the right place and stays in the right place during treatment. Therapeutic radiographers leave the patient in the room on their own, but watch them closely from the control area. We will move the treatment machine around the patient without touching them. We can check that the treatment will be correct before we deliver it by using X-ray imaging techniques. This allows us to see inside the patient in real time and adjust if required. Once we are all happy, then we will commence radiotherapy treatment, which will only take a few minutes. The patient does not see or feel anything. The patient will then go home and may come back the next day for more treatment, depending on their treatment regime. We get to know our patients really well if they are on a course of radiotherapy treatment. Sometimes we will see them every day for up to 37 working days. We will assess their condition day to day, manage any side effects, and give advice. As well as day-to-day treating of patients, therapeutic radiographers can also specialise and take on other roles as they progress through their career in areas such as pre-treatment, physics planning, leadership, patient review, prescribing, paediatrics, and technique development, just to name a few. We can also specialise in a particular type of cancer patient or technique, become a consultant radiographer, or go into education and training, or cancer research, like myself. To be a therapeutic radiographer, you need to be a professional, compassionate and caring person, but also good with technology and be willing to adapt to change. We mostly work in small teams and have to think on our feet. Therapeutic radiographers are good at problem solving, attention to detail and using initiative while always providing the best patient-centred care. If this sounds like you, then this could be the perfect career. We hope that you would consider a career as a therapeutic radiographer.